Taoiseach, our student nurses and midwives are incredible. They do invaluable nursing work while on placement on wards, and in fact they keep our hospitals going. They do a minimum of 28 hours a week, and they work far beyond their training duties. The McHugh review of 2022 addressed pay for intern nurses. However, the new subsistence allowance for first to third year student nurses doesn't go far enough and leaves so many in very difficult circumstances. The review failed to address supports for other students working in clinical placement in our health service. One student nurse wrote to, I think, every TD at the weekend to say, in my first 5 weeks of studying to be a general nurse, I was told how to save a life, how to bathe a paralysed patient, how to care for the elderly and infants, but then went on to say, it's clear to me that the role of a student nurse is not valued. The work that student nurses and midwives do is invaluable, but they are also experiencing a cost of living crisis. They struggle to find accommodation, they're forced to pay rip-off rent when they do so, they're forced to commute long distances when they can't. The mother of one student nurse wrote to my colleague Mairead Farrell to share the distressing situation that her daughter is in. She's a second-year student nurse. She commutes a long distance to and from her placement because she can't afford accommodation. She's slept on friends' sofas while working shifts in a maternity ward from 7:30 a.m. to 8:30 p.m. And now things are at breaking point for her. Her mother wrote this. She said, we now have to borrow money from family to put her up in a hotel for the days of her placement. The HSE told her not to even ask for reimbursement. We can't afford €300 a week. We're on low incomes. We're sick at the thought of what will happen. The stress it is causing is sickening. She breaks her back studying and working. She has the loveliest nature and will be a lovely nurse, one of the nurses that our country is crying out for. Surely this can't be right. And Taoiseach, this student nurse is not alone. So many others are pushed into very difficult situations while pursuing their qualification and working hard for us in our hospitals. And by the way, this isn't about a return to the apprenticeship model. This is about a fair deal for students working in our health service. Tá sé thar go mbeadh rialtas agin a thurthach coram na féine de oibrithe chuireann sláinte in Ilúint. Taoiseach, do you agree with me that healthcare workers in training should have a fair deal for the work they do when on placement? And will you commit to delivering that fair deal for first to third year student nurses and midwives?
Thank you, Deputy McDonald. Taoiseach, please.
Thanks very much, Can Corlin. I want to thank Deputy McDonald for raising this important issue, and I join with her in acknowledging, as she rightly says, the very important role that student nurses play in our health system, in our hospitals, in our community during their training, and she's quite right to make that point. And of course, student nurses in their fourth year and their final year are paid, but you're talking specifically about their first to third year as well. Now, my colleague, the Minister for Health, I know, did have an expert review group that did look at that profession in general and how we could support people at all stages of their progression from the student nurse right through. And my understanding is that that report did make a number of recommendations in relation to increased levels of support and subsistence, recognising things around travel and accommodation. I truthfully don't have it here in front of me, but from my memory, I think this was something that would have been developed in consultation with the likes of the INMO as well. But we're certainly happy if there is a wish to have further engagement on that with the representatives to do just that, because you are right, we all want, I think we can agree on this, we all want a fair deal for those that are providing care, albeit as students in our hospitals, because that care is invaluable, and we do want that to be fair. And certainly we had taken some measures to endeavour to address that. But clearly you're outlining a case there that the Minister for Health would be happy to take a look at and maybe raise with nurse representative bodies like the INMO, because we were of the view that we had made some progress through that expert review group report. But let's take that away. Very happy to do that. I would, while we're on the issue, make the broader point, and you said not to mention the apprenticeship model because I think that's separate to your question, I do get that, but I would make the point we have tried to broaden the number of places in the country where you can access nurse education and tried to partner more with local hospitals in that area. So indeed, Deputy Farrell, who's brought this issue to your attention, would know very much in the Galway area, working now with the tertiary degree programme. We have seen more opportunities for more people to access nursing courses closer to their home, and also hopefully their placement in what we could call as the local or regional hospital as well. I hope that'll have a positive impact. But look, we want more student nurses. We're trying to grow the number of people who are studying nursing. We're growing the number of college places in our healthcare professions. And of course, if there's cases coming through of people who are finding that cost of living challenge acute, the Minister for Health will be happy to engage further on it.
Thank you for that, Taoiseach. You remember during COVID, and there was a huge discussion around student nurses and midwives and the work that was being done, and the fact that at that point that wasn't being adequately recognised and compensated. And I just think it's really problematic that we're back in a space where young students of nursing and midwifery feel again that they're not being recognised and they're not being valued. The last thing we want is these young professionals feeling that they are not valued within the Irish health system and making a decision to make their contribution in Perth or Toronto or wherever that might be. The case brought to the attention of Deputy Farrell is by no means an isolated incident. This is a widespread experience. And in fact, many of the students are now talking about organising for demonstrations and to bring political pressure to bear, and rightly so. We have a proposal, Taoiseach, for a €3,000 bursary. We'd like to discuss that with you. We hope that you would adopt, not least because we'll be heading into elections very soon. You inform us. And young people and students working within the healthcare system are going to watch very carefully to see what we have to say and to see whether or not, Taoiseach, we are prepared to put our money where our mouths are. On this side of the House, we certainly are. I'll send on details of the individual case to the Minister, but I hope you take the point, and it's made in good faith, that it is in all of our collective interest to get this right for these students, make sure that they can live, that they can survive, and in fact that they can thrive.
Thank you, Deputy McDonald.
I'm glad you've picked up my election hints anyway. I thought they were rather subtle. I thought, there goes the surprise. But no, look, thank you. No, look, it's a serious issue the Deputy's raising, and I do appreciate that. Look, I'd make the point fairly that we have significantly increased the level of supports to our student nurses. We did that, as you rightly say, arising from the debate around COVID and post-COVID in relation to the very important role being played by student nurses. Again, I don't have the specific figures in front of me, but I think the level of support we're providing through that subsistence, travel and other supports has risen by several million over the last couple of years. But we are happy to engage further on this. I would also make the point to those student nurses, of course we've also done other things that will help them along with other students, whether that's reducing student fees, improving student grants, making nursing available in more parts of the country and in ways that works for more people, and also extending the renters tax credit to cover students as well. But very happy to take a look at it. The only thing I would say, as we come into that election season, we obviously do need to acknowledge there's lots of students carrying out important placements as well. And obviously when you look at one group, and nurses and student nurses are an extremely important group, having some degree of a consistent approach, I think, to all of the people that are playing an important role in our health services students is something that certainly I know other professions would mention to us regularly as well. But I'm happy to follow up. Thank you.